We've talked a little bit so far about Dr. Thomas Szasz being wrong and about him being essentially out of date. We haven't talked about Dr. Thomas Szasz's hypocrisy, however, and that, in my opinion, is probably the most egregious issue against him that is coming up as we look at this topic. To review, Szasz is a man who has been writing for 50 years from a libertarian perspective, arguing for self-determination and against state interference in matters such as behavioral control. Szasz rejects and has always rejected state authority to detain or hospitalize and treat a person against his or her will. Szasz has always rejected psychiatry's apparent role in making this happen by labeling questionable behaviors as an illness, hence justifying state interference and control. And Szasz has also rejected any provision of medical or psychiatric treatment without full informed consent and thereby free choice by the recipient. So we've reviewed that. Szasz also, in addition to this, has been a founding director of the Citizens Commission for Human Rights since 1969. He's allowed himself to receive awards and recognition from the CCHR over the years. He has allowed his arguments and his writings to serve as the intellectual foundation for the CCHR's and Scientology's war against psychiatry, and he's encouraged that. About this, he's merely stated in public that he is not a Scientologist, and as an atheist, he's in support of any religion which opposes the same aspects of psychiatry that he opposes himself. Dr. Thomas Szasz is the embodiment of the concept of, quote, the enemy of my enemy is my friend. My question is, so how is this so bad? Let's explore that. I want to talk about what in Scientology is called the introspection rundown. In the mid-1970s, L. Ron Hubbard announced that he had, quote, made a technical breakthrough which possibly ranks with the major discoveries of the 20th century, unquote. Another bit of Hubbard's trademark modesty. He was describing essentially a process by which to handle a psychotic break. He noted that the psychotic break, or someone developing acute psychotic symptoms such as delusions or hallucinations or gross disturbance in perception, behavior, was the last of the unsolvable conditions that can trap a person. And thanks to his introspection rundown, quote, the last reason to have psychiatry around is gone, unquote. So to clarify, by the 1970s, L. Ron Hubbard is proposing a specific treatment protocol for a potentially dangerous condition, usually managed by specialist level physicians and in a hospital. In his bulletin of January 23, 1974, Hubbard told his followers, quote, you have in your hands the tool to take over mental therapy in full. Frightening. The essence of the introspection rundown is isolation and destimulation. Essentially, the person who is undergoing the IR has his or her case run by a case supervisor, and the protocol is that nobody else should have access or contact with the person involved. The individual stays isolated and silent except for the frequent auditing sessions that he or she has with the case supervisor. Given that it's Scientology, there's likely some nutritional aspects to this, and likely they throw some high doses of vitamins at the person, but there would be no traditional psychiatric medications offered to an individual on the introspection rundown under any circumstance. Where this becomes interesting to our story is that the key to the introspection rundown is that it is the case supervisor who decides when to end this period of enforced isolation. That is, the psychotic person undergoing the IR loses his or her right under Scientology protocol to choose when to leave that isolation room and to choose the nature of the treatment that he or she gets on an ongoing basis. This is not some kind of esoteric point. It's entirely obvious from all of the bulletins that Hubbard produced, bulletins that are still in force in Scientology, and we can see this very clearly. To determine the end point of someone's enforced isolation in the IR, the supervisor in charge has to, according to Hubbard and according to Scientology protocol, indirectly communicate with that person to find out whether they are capable of taking responsibility at this point or not. And that's, the example they give in the introspection rundown is using a note. And according to the IR document, a note might be something like, quote, "Dear Joe, what can you guarantee me if you are let out of isolation?" If Joe's answer shows continued irresponsibility, the supervisor must write back something along the lines of, "Dear Joe, I'm sorry, but it's no go on coming out of isolation yet. Your actions threaten the survival of hundreds of people indirectly." The IR goes on to state, when it is obvious the person is out of his psychosis and up to the responsibility of living with others, his isolation is ended. And these words, as I've just mentioned, are all contained within the Technical Bulletins of Scientology, Volume 10 from 1991. These are still in force and in play in Scientology. Elsewhere in these protocols supporting the introspection rundown, it is stated, with someone in a psychotic break, it is necessary to isolate the person for him to destimulate and to protect him and others from possible damage. There comes a point where the case supervisor must decide to release the person from isolation. The case supervisor release the person from isolation. To do this, the case supervisor must know that the person can take responsibility for his actions as regards others as well as towards himself. So thinking about what Zaz says, this is becoming very interesting. The current consent form used in Scientology has a lot to do with the introspection rundown, and it's kind of a blanket consent form, but it specifically talks about the protocols of the introspection rundown and the specifics, just because of these very thorny control and responsibility and coercion issues. So what I'm talking about is what's called the Church of Scientology Flag Services Organization, hereinafter referred to as the Church Agreement and General Release regarding spiritual assistance. Scientology actually calls the introspection rundown, quote, an intensive, rigorous religious service, unquote, which is interesting because it's designed specifically for people who are psychotic, which is a psychiatric or a medical condition.